Chris Byer.
Mr. Byer, we have a great guest. I have known Heath for over a year. Heath Parker is with NOMI. NOMI is the company that is not only building cost containment networks, but they're really out there to figure out how do we compete with the BUCAs. So they're actually wanting to have a full replacement network. Heath has been amazing to work with. Heath, number one, thank you for joining us today because I know you are extremely busy.
Thank you for having me. Appreciate it.
Absolutely. So Heath, give us a little bit of a background, who you are and how you got into cost containment from a medical standpoint as you're working with providers across the country.
Sure. So Heath Parker, Senior VP of Global Sales here at NOMI Health. Been here for 13 months now. Prior to that, was with a large independent third-party administrator for about 16 years. In the last 4 or 5 years, we did a lot of direct-to-employer type programs. And with that being said, is just learning the pathways of direct contracting, different pieces and pushes there. That's where we're going. The next 5 years, from today, it's a lot about value-based healthcare. It's direct contracting and tying the employer, bringing the employer back together again. So again, that's really background wise.
Well, so we've talked a lot about direct contracting. Certainly we've had our VIP network now backed by NOMI for the last 4 years for our self-funded employers. But if you wouldn't mind, how does NOMI and direct contracting help the employer and also the member and maybe even the provider in contrast to what you typically see with a traditional healthcare network that we're used to with our health insurance carriers?
Sure. There's really a few different parts that go into it. When we look at, the employer side of things, it's trying to, reduce cost. Every employer's, how do you drive, cost savings, to our members? But one of the biggest things today that people struggle with is plan design. And being able to offer a plan that if we can get these direct contracts done and steer people in those direct contracts, they're able to get those at no cost, no copay, on that side of things. What that does is it actually allows for, people to get things done, which will bring costs down instead of waiting to get it done and, down the road.
Right.
I can get it done now, which is going to reduce my costs. So from the employer side, it's that piece. The employee side is that can actually sleep at night, that they have an option from their employer that allows them to, be able to use the healthcare system. Those are two things that, really stick out from the employer and the employee side.
No, I think that's so true. I mean, for years and years, insurance brokers, consultants said, we got to reduce costs, so raise the deductible. We just push that back on the employee. And you're exactly right. It's gotten to the point where healthcare is not even affordable, even with insurance from that standpoint. Chris, I know our clients love being able to tell their employees and members, hey, we're offering you no cost healthcare. You can go and have these procedures for no cost. And it's such a great recruiting and retention tool because it makes a true impact for the family. And we're saving money too for the employer.
Yes.
So Heath, what do you see as the future for this? Chris alluded to a little bit about a replacement network, but you could go down that path. But what do you see coming up in the next several years as this concept is really taking hold across the country, both from the provider side and the employer side, as well as consultants?
Yeah, so from our side of things is that we do see, full replacement. Our goal is to be in 35 MSAs over the next 5 years. What I mean by that is that, and when I say full replacement, it's trying to look at all the different providers and bring a motto to them that says, one of the challenging things with a provider is that they have a negotiation with a carrier, that what is the one thing that they thought they got a great deal? What's the thing they don't control? The one thing they don't control is the plan design. If we can say one plan design, it's this plan design that eliminates, because the one thing for providers today is their AR. Their AR is going up 30 to 40%, their accounts receivable. Because again, we talked about earlier the $500. We talk about the idea of the member responsibility. If we can eliminate that, then again, get an aggressive rate so that we can actually have people use the system. So that is our future, is, to really build networks in these MSAs, to partner, with the providers in the community to bring things back there. And then the member and the employer, because again, as Chris has talked about, is that people have pushed as far as they can on the plan design. And again, attract and retaining, the idea of presenteeism, absenteeism, all those things improve with this.
Yeah.
Can get it done now. Yeah, I might not like it, but again, it's going to reduce my cost down the road. And that's what we're trying to do when we talk about managing risk.
It's so
something
true.
Something we just learned, Heath, is we had a large carrier in our main health system go through a contract renegotiation. And what we learned from that is the bulk of the pressure on the big carrier was the Medicaid, Medicare reimbursement. And that leaked into the commercial health reimbursement model. So I think that's what I'm so excited about what you're doing, is that you can truly go in and negotiate on commercial health. You don't have this big backpack full of lead that you're trying to figure out, well, how do I help you on the Medicaid, Medicare side? I just want to focus on self-funded, employer-paid health insurance, or fully insured, level funded, whatever it is. So I'm excited about what you're doing, and I think this recent negotiation opened up all of our eyes of, hey, all of our commercial carriers are going to be going through this with every single health system.
Yeah.
One of the things I would add to that as well is that when we look at, the provider scoring side of things, right, is that two of the top three things that they get surveyed from the actual members is, one, I don't understand my bill.
Right.
Two is I got sent to collections and don't understand why.
Yes.
When they use the NOMI network with our plan design, we eliminate that. So we actually increase the promoter score for the actual provider, which is another positive thing on the provider side.
Yeah. I had it happen just this morning. I had to go in for a visit to the clinic. Got a high deductible health plan, $4,000 deductible. I know I'm going to get billed after the fact, and the provider's like, we need to collect a little bit of that up front today, because we don't want that balance to get too high, because they're scared that I'm not going to pay it. So that is the first time that clinic has asked me to prepay anything at all. And it's just interesting, because we're seeing that trend happen more and more, because they can't handle all those open balances.
The goal for us from NOMI side of things is that when somebody sees the NOMI network on their ID card, is that the provider knows I don't have to collect. And I welcome those patients in, because I know I don't have to have all the different, layers and layers and layers of costs that get added inside a traditional network. So that's what we're excited about.
No, it's awesome. Chris, I know you've got a question to ask Heath as we finish up in focus here this morning. This has been a great discussion.
So Heath, you've had a rough day. Maybe you had to deal with me, and or maybe it was a provider, or it was an employee that just struggles. Do you have a motto? Do you have a statement? Do you have something that helps you get through both the good days and the really difficult days?
I do, and appreciate you asking. And I look at it as change isn't easy, but disrupting is even better. And again,
I like
it's just it's what keeps us going each day. Is that it's not easy, but again, we know we're going to make a difference, and that's what we're here to do.
I love it. Thank you.
That's a great quote. Thank you, Heath, for joining us in focus this morning. Great to get to meet you a little bit more and hear more about what you're doing with NOMI. Appreciate it.
Yeah, I really appreciate your time.
So much. Appreciate you. Thank you. Bye-bye.